Welcome to the Wellness on Tap podcast with your host, Dr. Debs Eastwood.
Earlier, I was talking about the news and how there's not much good news that we're told about. Now, over the past few months, we're being told that 50% of us are going to end up with cancer. I mean, that's really not good news at all. Mm-mm. So let's dive into this and from your perspective, medical background, explain to us, what is cancer?
In very simplistic terms, cancer is where the normal cells of our body go rogue. There are many, many reasons why that happens, but it all goes back to genetics. So there is something that triggers genes in our body that would normally switch off the growth of cells when they're not needed, and that mechanism is lost. So we all need the cells in our body to be able to grow and to multiply, but it's done in a very controlled fashion normally. Can you imagine if you cut yourself and it never healed because your cells didn't grow? If your bone didn't replenish itself, for instance, then, we'd all be in a pretty sorry state by the time we were a few years old if you had a childhood like mine where you're forever bouncing up and down off your knees when you'd fallen off various things. But it's done in a very controlled fashion. The body tightly regulates it. And for whatever reason, the genes that regulate it are disrupted in their activity and they don't hear the signals to stop. And they just continue growing.
Do we all have cancer cells in us?
Very good question. We all have the potential for cancer to grow within us because we all have cells that grow and divide regularly every day. And we all have genetics in the nucleus of our cells. We all have genes that get switched on and off. There are cells, for instance, in the blood. So the bone marrow is a really good example. The bone marrow is basically a little factory that grows blood cells of different types. And if we didn't have that factory and we bled, we would just be depleting the stores of the blood that we've got if we didn't have the ability to make any more. But it's a highly controlled environment. So the body has ways of looking at itself and saying, yes, I've got enough of that particular type of white cell now. I'll switch that, turn that machine off for a little while until we need it again. And the same with all the different types of blood cells. That's one of the mechanisms for leukemias, for instance, which are cancers of the blood. That mechanism is disrupted and it's not turned off. So yes, we have the potential.
Right. I mean, something that puzzles me is that we're supposed to be living in probably one of the most advanced technological societies ever. And yet the incidence of cancer seems to be going up. Mm-hmm. And yet more and more is spent on research. But are we getting any closer to finding out what's causing it?
You're chucking some big questions at me here. This is good news. Okay, so there is a lot of really positive research happening, but it's a long process. A lot is known about how the body works in its normal state, which is the place you have to start. If you're going to be able to understand any abnormal processes, you have to know what the normal is to start with. And we're fairly good at that. I'm not saying that it's perfect. And a few years ago, when we were actually able to reproduce the human genome and understand it all, that was a massive leap forward in being able to help us understand what genes are involved, because it's all down at a very tiny, tiny level. So yes, we are making progress at the scientific lab bench sort of level, if you like. But we're also contributing to the incidence of cancer by putting into our bodies and by living in environments that are toxic to us, basically. And just like the very known causation between smoking cigarettes and lung cancer, down to the toxins that are within the cigarettes directly causing the cells in the lung to mutate. That's a very common word. You get mutations of the cells, mutations of the genes. We're surrounding ourselves more and more these days, by choice or otherwise, with different levels of toxins that perhaps some of which we don't even know are toxic to us, that we are ingesting, we're breathing in, we're eating, we're drinking, that are affecting the way our genes perform.
That's really interesting. I mean, have you got any specific things that, in the environment which are contributing towards the rise in cancer now that didn't used to happen? Is there anything that you're aware of?
I mean, it's quite an older one. It's not a new one, but the link between people that worked with asbestos caused a specific type of respiratory illness, asbestosis. The lung cancer is also another major one. And just exposure to the sun, causing melanomas and skin cancers of all different types. I mean, there has been a massive rise in cancers of the GI tract, so your gastrointestinal tract, right the way from the mouth down to your back passage, that are directly linked to the things that we are eating. There's an awful lot of microplastics that you find in your diet nowadays. The effects of that are still being investigated. And I'm not saying I'm going to provide any answers on that at the moment, but it's obviously not a right thing. It's not a food source. It doesn't nourish our bodies in any way to have plastic in our diet.
And it's so difficult to escape that. When you think about going to the supermarket, everything is wrapped in plastic.
Yeah.
Bottled water as opposed to what comes out of the tap, which isn't great, versus bottled water which contains microplastics.
Exactly. Yes, swings and roundabouts, isn't it? And
difficult.
That's what I mean about the environment being involved, and why, until we get more of a handle on what's around us, and by that I include foods that we ingest and just in the general environment, the water supply, etc., the lab bench stuff still needs to be happening, but it's never going to win the battle because it's not looking at the whole picture.
That's a very good point. I mean, there are some particularly aggressive forms of cancer. For instance, my ex-wife died of pancreatic cancer and was told when they discovered it, which was in the late stages, you've got 6 to 8 weeks to put your affairs in order.
Ouch.
And virtually to the day, probably one day less than 8 weeks, that was it.
That's pretty scary.
Very quick and accurate and frightening.
Yeah.
Conversely, there are people who've been told you've got 6 months, and 10 years later, happily, they're still going.
Absolutely.
I have no idea how that occurs or what kind of explanation there can be for this as to why some people, pancreatic is very quick and aggressive.
It is.
But as to why some other people manage to keep going despite being told they've got a very short period. What is it that they're doing, I wonder, which is keeping them going?
I remember reading years ago, I was in my 20s, a book, I think it's called The Transformed Cell. Still got a copy at home somewhere. And part of that it was a really good book that actually, when I recall it, was talking about the integration of allopathic and holistic health, even though I didn't realise it at the time. I'll have to lend you it so you can see what you think. And there was a story in there about a lady who'd got a cancer, I can't remember which type now, and she visualised it as this big ugly mass in the corner that she used to come at with a pickaxe and physically try to hack away at this cancer. And she was undergoing conventional treatments at the same time, but were upsetting her. And she found that was the most useful because she felt in control. So I wonder if mindset has got a part to play as well?
I think you're right there, and you're definitely onto something. Again, Marissa Peer, who does the rapid transformational therapy, had cancer and to a large extent used her mind to stop things from going any further. And some of the people who come to see us with cancer, not that we advertise that we help with that, but if they do choose to come to see us, we say, okay, well, you can only come as long as you're telling your oncologist that you're coming to see us and that we'll be using perhaps hyperbaric oxygen therapy alongside more traditional methods. But what we found is that some of them have a common denominator, which is trauma.
Ah, okay.
And for instance, we had one lady come in who said, look, I know why I've got this. I should have left that bastard 5 years ago. And I didn't, and now this is the result.
Wow.
Another lady who had been in a toxic relationship for a number of years, had left him, had stage 3 breast cancer, but had got into a healthier relationship afterwards. And again, she put that down to having stayed in that toxic relationship for too long. So I'm just wondering if there is some kind of link in some instances between trauma and cancer.
I'm absolutely certain that there is, because trauma causes stress. Some of that you may physically manifest itself in symptoms that you're very aware of. You know, it could give you problems with your anger, it could make you sad, it could be all sorts of things that are really easy to see. But stress affects your cells as well. It affects your chemical balance internally. And if you've got an imbalance in the chemicals that are governing the control of your body, logic dictates that in some populations, in some poor individuals, that is going to have an effect on their gene expression and therefore whether they can regulate the normal processes within their body in the way that it should be regulated. I mean, you see ladies, for instance, who have problems with the monthly cycle because they're stressed. So it's obvious that there's something going on inside the body because that's actually altering the way your hormones work.
That makes a lot of sense. There's a wonderful book by, I think it's Bruce Lipton, called The Body Keeps the Score.
Oh, I've heard of that.
And what that proposes is that with each traumatic event, the body stores the trauma. And then if you keep piling on more trauma, the body will remember, and it just builds and builds and builds, which then, as you're saying, may result in a physical manifestation or an outpouring because it has to come out somewhere.
Yeah.
Or turn inwards and do something else.
Absolutely. You know, I mean, there's plenty of stories out there, isn't there, where people become ill because of stress. And like you said, cancer is something that's growing in today's society. The number of people that are affected by it. I mean, even in my lifetime, I remember as a kid, as sort of like an older kid, stories on the television of the numbers of people getting cancer. It was sort of 1 in 4, 1 in 5 people, each family will probably have somebody in it with cancer, was the news back then. And now the incidence, like you said, is sort of 1 in 2, 1 in 3. Surely we're living healthier lives. What's that all about?
I think some of it goes back to what you're saying about the microplastics. And I think there must be something in the diets that we're having at the moment. And what that's making me think about is pesticides, what gets sprayed on crops, the type of farming that's done nowadays with regard to animals, and whether they are bunched up together. Because a large part of that is how much money can be made out of farming. And if it means squashing more animals together, well, you do that and they get sick.
Of course.
And then they inject them with antibiotics, which people then eat, and it goes into the food chain. And I just wonder, is that a contributory factor? I don't know, really. It's just a question.
I mean, I'm sure it must be. I mean, think back to people that were living in the slums, or even before that, in 1700s when people were crammed in together. The rate of infection and the mortality rate from that was huge, wasn't it? I mean, kids regularly didn't make it through to adulthood because of the conditions they were living in. And it's the same concept, isn't it? Too many people living too closely together, whether it's a human being or whether it be a farmed animal that goes into our food. It's the same concept. It's not healthy. You have to have access to clean air and a bit of space, a bit of distance. That's what that 2 metre thing was about in COVID, wasn't it? But, that's a whole nother story.
Certainly is.
So if somebody gets a diagnosis of cancer, going through the medical method, there's a couple of approaches, isn't there? Some cancers, they just watch and wait because they're so slow growing and, there's not really any need to intervene at that point in time until the person becomes symptomatic. It might be a finding that comes up, an incidental finding, we call it, something that comes up just because they're having some other test, and this is found. The other end of the scale is radiotherapy, chemotherapy, and surgery, often with radiotherapy or chemotherapy before and afterwards, all of which are really debilitating to the body. Not necessarily curative. Some cases it is, which is, fantastic, but the body's gone through a hell of a lot. And you often find that, and maybe you're making me think now, that because of the trauma that our bodies store, that's a traumatic episode in itself. So is that predisposing to a recurrence later on down the line? I don't know. I'm speculating here.
That's a really good question, because certainly studying bioresonance, any cut in the body or whatever unbalances the body. And when you've got something as invasive as that, then, surely there is an imbalance. And we don't know the impact of that.
Yeah.
So, whether that leads to recurrence, which leads to more of the same and so on, something worth looking at.
I certainly think so. And I know in a couple of places, it's very, very niche, some places do have hyperbaric oxygen chambers within the hospital grounds that are used by patients because they know that hyperbaric oxygen helps healing.
That's certainly the case with regard to a number of cancers, because cancer just doesn't like oxygen. Similar to a number of other chronic illnesses like Alzheimer's and dementia, where it's been found again that starving the brain of oxygen has an impact. Been found in traumatic brain injuries. And again, with cancer, maybe that is something that can help with regard to stopping the spread, because cancer really doesn't like oxygen.
That's quite amazing. I didn't know that. So the hyperbaric oxygen chamber that you've got in Wimbledon, I guess you have cancer patients coming through there for treatment as well as the other modalities?
We do, but as I mentioned, we say you've got to tell your oncologist or you don't come in through the door. But putting the two together in tandem, again, it's the integration of holistic and allopathic where it's needed that way to get the best bang for your buck, the best result that you can.
Yeah. So really, it should be much more widespread, shouldn't it, within our hospital system?
I believe so. I mean, a lot of sporting teams, top of the league, use these things as well because they know it fixes injury more quickly. And so that's what they use them for. And again, it's something that's not rocket science, and it's been around for ages. It actually comes from deep sea diving.
Yes. Yeah, that's where I think most people will know about it. Divers get in the bends, won't it?
That's right.
Yeah. and getting cured because of that. So yeah, it's obvious that it's had healing modalities and needs more explanation, more exploration even. Yeah, it needs to be there. So you've personally had the experience of cancer and chosen to go down the holistic healing route with no side effects, and you are cured, for want of a better word. Can I use that word, do you think?
I'd be hesitant to say cured, but I don't suffer any symptoms.
Which is wonderful. Which is wonderful. And it's the sort of thing I would love to have found with regards to my brother when he was sick. Maybe if he'd have known about that and had access to it, then the damage that the cancer was doing to his heart and his kidneys may well have at least been stalled. Who knows? We'll never know now. But the fact that it could change the prognosis for so many people, give them back their quality of life, is just such a huge thing.
It is, and I'm ever hopeful that the word will get out.
Yeah.
And that people will start to look at other methods. Not saying the traditional ones are no good, but you can use them in tandem.
Yeah.
And just get the best of both worlds, put them together, integrate it.
Yeah.
Rather than this is good, that's bad. No. What are the advantages of each of these? And let's combine them.
Yeah.
And when you look at, as I say, the incidence of cancer now, we should be looking at everything
Totally,
possible.
yeah. And the NHS is so overstretched. Why put even more pressure on it? Why not spread that load?
Absolutely.
Yeah. Health of the population's important. And if we're just relying on one thing, we're never going to get there, are we?
We're not. As you say, it's coming back to the holistic view.
Yeah.
Let's look at what's in the food chain. I mean, sometimes I've gone to the supermarket and I've gone to buy something and I've picked it up, be it a sandwich or whatever, and I think, I look at what's inside because that's how my crazy mind works. And I think, hang on, I can't even pronounce that. What the hell is that doing in a sandwich?
Yeah.
And then, I go away and do some research into what this unpronounceable thing is that's in the sandwich. And I think, well, that's not something that should be going into a human body.
Yeah, exactly.
And then we look at, farming methods going back to that. Wheat now is grown far differently to how it used to be grown in the past. Now it shoots up really high because of all the stuff that's put into it to make it grow faster, quicker. Whatever that is that something that ought to be put in our bodies? Because our grandparents, great-grandparents didn't have this stuff. And they used to live and eat a lot of bread.
Yes.
Staple diet.
Yes.
And it didn't make them ill. Whereas now, if we think about all the allergies and things that exist, even last night in the hotel, I went and ordered my meal and they said, have you got any allergies? Which they always have to ask now.
Yes.
When did that become a thing?
Yeah, that is recent, isn't it? Yeah. That's another topic. We've got to dive into that one at some point then, haven't we, as well? We're getting more and more. This is really wonderful. This is good. So when you said about the wheat, immediately I was like, well, that's how cancer cells grow. It's forced growth. Fast.
Wow.
That was immediately where my mind went.
My goodness, that's a really fascinating one. About, where are we now? Yeah, I think it was about 6 or 7 years ago, went to the States for a holiday and went to this restaurant, ordered something, and they said it was going to take about 40 minutes. Would you like a starter? I said, okay, some chicken wings. And they brought out something that looked like turkey drumsticks. Massive. I said, no, chicken wings. He said, these are chicken wings.
Wow.
And I looked at these things and thought, oh, what kind of chicken wings? They've been lifting weights and doing all sorts. Whoa. Totally hench chickens. Crikey. But then, funnily, the year after, went to Sri Lanka and saw chickens that were like this, tiny, skinny little things with no meat on them whatsoever. And then you compare the two and you think, these American chickens, they've been working out so much. And these Sri Lankan chickens, they're just puny, they're just not doing the exercise. And what on earth is going into those American chickens to make them have these hench wings? Yeah. And then we're eating that.
Exactly.
But again, it's probably something that's not compatible with the human body, or shouldn't be, or isn't.
I would certainly imagine so. So, where is this all going to end?
That's a very good question.
Getting my own back on you now.
You are indeed. Because supposedly organic food hasn't got or has less of this stuff in it. Less pesticides. Organic meat is supposed to be more clean. It's supposed to not be as full of antibiotics or whatever else they're putting into the animals. It's certainly more expensive, but sometimes I have to question, is that what's happening, or are people just being overcharged? I've no idea.
No, me neither.
But to be on the safe side where possible and where it's not too expensive, I will go organic where possible. Simply because I'm hopeful that it has less stuff in it that it shouldn't have.
For sure. So that's taken me to my great uncle, who was a fabulous kitchen gardener. He lived in one of these terraced houses, with the super long back gardens that went on forever and ever. And he used to grow so much of his own stuff. He was incredible. He was sprightly. He used to beat me across the road to the pub, and he was in his 80s. I know, he's just a fabulous chap. And that's what a lot of people used to do, didn't it?
Absolutely.
They used to grow their own instead of going out and buying pre-wrapped plastic. And I heard a statistic that if we went to the shop now and bought, a satsuma or an orange or anything like that, we would have to eat 20 of them to get the nutritional value out of it that we would have had from eating one 50 years ago.
Absolutely. Absolutely right. These things have about 20% of the nutritional value of those 50 years ago. Again, it comes back to the way that they farmed, like your relative's garden, he would probably leave a bit for a year and then, what they call it, leaving it fallow, don't they?
Something like that, yeah.
The soil
crop rotation, but in an organic way.
Yes. Regenerative farming, where you sort of let the soil heal before you put some more stuff in for it to grow. Whereas now it's just keep putting more stuff in.
Yeah.
The soil's got no nutrition in it.
Yeah.
So what's growing in the soil doesn't have any nutrition in it. And as you say, we just have to eat more and more and more and more of it to get the same nutrition.
Yes.
Which will bring us on to another interesting topic, supplements.
Oh, I'm certain that it will. Yes, there will be topics about nutrition and supplements. And I was just thinking about a lady we both know, Paula Carnell, who's into the bees. And when we were talking about organic, she says that there are so few areas in the UK today where bees that roam for 5 miles, which was something I didn't know, to collect the pollen to make the honey, that the UK can't say that it has a true organic honey supply because there isn't 5 square miles or diameter or whatever radius in the UK that doesn't use some sort of pesticides or near to motorways or airports or something that chucks a lot of toxic stuff into our environment.
Crikey, that's frightening.
Isn't it?
And what's even weirder, you just put this picture in my head of people going around the crops. They've got like hazmat suits on, things on their head, they're, all covered up in the body, and they're spraying the food which we're going to eat with this stuff.
Yeah.
And that ought to be a big enough red flag, shouldn't it?
Yeah, doesn't it? Somebody wearing a hazmat suit spraying your food. Yeah. So that was a really interesting one. So apparently Spain is the nearest place where we can get true organic honey.
Wow.
So sorry, Paula, if I've quoted you wrong, but I'm pretty sure that was what you said. But yeah, I'll have to have a more in-depth chat with her, I think, in the future. That would be really interesting.
I mean, that's got incredible implications for the whole ecosystem, hasn't it? Crikey, sort of spin that out a bit.
Big topic.
Yeah.
Big topic. And like we say, if you just think about it from the bees' point of view, if they haven't got enough space and they can fly wherever they want to get hold of an organic diet, what chance have we got?
Gosh. That's also led me on to something else. I'm just thinking about that. There are certain people in the world who are saying that, we shouldn't eat animals and that we should eat bugs.
Ooh.
I don't quite go along with that myself.
No.
But the thing is that even the bugs are going to be as toxic as anything else, aren't they?
Surely.
Yeah, so that doesn't make sense.
They're living in the same earth if they're the burrowing kind.
Yeah. Yes, there's no sense in that argument whatsoever.
There we go. That's that one put to bed. Yeah, so I think I know you as well have heard about some people that are going completely off grid. They're trying to find a patch of land in the middle of nowhere that has never been brownfield, that, has always been farming land or some other kind of green completely from the go, far enough away from anything else, and setting up their own communities. So in off-grid, in the context of cancer, I'm talking about away from environmental hazards and pollutions, where they're growing their own foods. I mean, I know a lot of these people also want to have their own electricity, currency, et cetera, but on a smaller scale, on an individual family sort of level, people are moving more and more towards that, aren't they? So that they can try and get back to the way food used to be produced and the environments we used to live in.
They are. I mean, it's very difficult in some places because even if you think about the rivers, which are totally polluted now with all kinds of nasties, and the land around those, the soil, for instance, they have been tipping chemical contaminants into rivers for years.
Yeah.
And this seeps into the soil. And again, grow stuff in the soil, it's got those chemical contaminants in it, and we're taking those in as well. So to find land that's clean to do that is a challenge to start with.
I agree.
But yes, there are a lot of people who are moving in that direction to go off grid, to disconnect themselves from the 24-hour, 24/7 craziness that they see around them, and saying, let's just get out of this rat race and go back to a simpler life.
Yeah, simpler, healthier lifestyle.
Which also links into homeschooling.
Go on.
Well, a lot of people now are considering, and in fact doing, in some instances, taking their children out of school and homeschooling them. And there are things called forest schools and things where kids are allowed to play until they're a lot older. And I think it's some Scandinavian countries, the kids don't go to school until about 7.
Yeah.
They just play, rather than being told what to do an awful lot earlier. And again, that's going back to nature. It's a more natural way of doing things.
Yeah, that's true.
And a more natural way of learning. We're going right off topic here, aren't we? Goodness
We are,
me.
but it's all around health.
And it's just looking at how children learn in nature as opposed to what they're being told. Now, if you think about how education is going to change anyway, with AI coming in.
Yeah.
I mean, probably in future, kids will just be given a topic which they'll go and look up on their phone or something, study it, come back and discuss it the next day. So they've done their own research and reading about it, and they're discussing it with each other, and that's how they will learn, as opposed to rote learning, which certainly took place a long time ago in my day at school.
I concur. Yeah, I mean, that sounds healthier. It sounds like a more integrative approach, in that even if AI is doing the research, they've got to come back with an opinion on it to be able to have a debate and a discussion with others about it. So maybe it will be more holistic at the end of the day, which would be interesting.
It would be. And I think that word you use there, debate, is great. And I think if you just look at sort of what's occurring nowadays, there isn't a great deal of useful debate. There's a lot of polarity and polarization, but there's not a lot of cross-fertilization of ideas or, saying, okay, I'll take your point, but now listen to mine and so on. There's not a lot of that. It's pick a side. And if you're on the other side, boom.
Yeah. I think people are too scared maybe to discuss the nitty-gritty, expose their weaknesses maybe. It's easier just to jump all in on one side or the other, isn't it?
Yeah,
And
the
not have
nuances get lost, don't they?
Yes. But I hope that going forward, the education that our kids will get will include much more about their health and welfare in every sense of the word, not just their physical body, their mental health, their spiritual health, their emotional health, and how they all work together. They're not independent things.
Absolutely. This is what, part of what some of us were taught when we first started school, taught things like domestic science, how to cook a meal and stuff like that. And then that went out of the window and TV dinners came in and freezers. Do you remember those big cavernous freezers?
Oh, God, yes.
And the shop would consist of, your weekly shop, just filling the freezer.
Yeah.
And stuff would sink to the bottom and just have the most recent stuff off the top. And the rest of it, sell by date.
Yes, that was a while ago.
It was.
Oh, yeah.
But now people, and children in particular, are not taught how to make meals or...
Which again contributes to the amount of rubbish in your body. And we're back where we started, aren't we?
We are indeed. And I know that some councils now are a bit more responsible. They don't allow a certain number of fast food shops to open next to schools. But if you look at the size of, okay, let's talk about obesity. Mm-hmm. That's massive now. If I think back to school, there's probably one person in the class who might have been a little on the large size.
Yeah.
Now, in this country, it's about 60% of people are overweight, moving towards obese. And if we don't do something about it soon, it's going to be an even larger number.
Yeah.
Now, you as a medic know all the spin-offs from obesity because you have to deal with that every day. I mean, what sort of things does it create for people health-wise?
I mean, as an anaesthetist, I'll speak from my strengths. Obese people, quite often, we struggle to find a vein, which when you're giving somebody an anaesthetic is an absolutely critical part of it. Often getting them comfortably positioned on an operating table, which is quite a narrow thing, can be really difficult. Getting these people through a CT scanner. MRI. CTs are normally big enough, but an MRI, a lot of these people don't physically fit through. Moving them. So if I've got a patient who's on a trolley and I have to move them over onto the operating table, it takes a considerable number of staff to do that, even with a hover mat. Their airways might be difficult. It's difficult for the surgeons to operate. It's difficult in every way, shape or form in terms of surgery, and they don't heal as well. If you've got big skin folds and you've had surgery underneath the skin fold, it just doesn't get exposed to the air. It can't be cleaned as easily.
Goodness.
Bacteria will grow more readily.
Never thought about that.
There's lots of things, and that's just a handful, a snippet from an anaesthetic perspective.
And is obesity a marker for cancer at all? Is there any link there?
I don't know the figures, but it's linked to diabetes, high blood pressure, and certainly the need for joint replacements, which can't get done if you're too obese because there's no point. So certainly for lots of other medical conditions. But
God, there's a common thread running through all this, isn't there?
yes, lifestyle wins.
Yes. And again, the holistic preventative method, looking at what we're putting in and the quality of what we're putting in
Absolutely.
and the quantity of it plays a huge role in that.
Got to be a good starting point, hasn't it? It's something that we can potentially have a little more control over just by making sensible choices.
That and educating the kids.
Yeah, definitely.
I mean, there's nothing more kind of upsetting than when you see kids piling out of school, all the fast food shops. They go straight in, grab a big pile of something extremely unhealthy, put a load of salt on it, ton of ketchup, eat that, go home, have tea.
Yeah.
And then sit there and play on the phones or computers the rest of the evening.
Yes.
And then we wonder why we have this epidemic.
Education. Hopefully, us talking like this, people will listen and will see that potentially some of it's a really easy thing to do. It takes a bit of willpower.
Yes.
But once you've got the education and you actually know what it is that you're doing to your body and how you can change that, I would love to be able to get that message over and to help people. Even if it's only just a small step, even if it's just that, so this is how I can get started on that. Because maybe they just don't know.
I think you've hit the nail on the head there. And the getting started is the other one. Because, as we were talking about earlier, procrastination is a real thing, isn't it? And humans would rather do the easy thing rather than the hard thing. And it will take 21 days or thereabouts to change a habit.
Yeah.
But if we just start to make a little start.
Yeah, tiny step.
That's the thing, a tiny step.
Yes. We need to talk some more going forwards.
We absolutely do, don't we?
And find lots of other things that we can discuss, because I'm sure there must be a million topics in there that we could talk about more.
There are, because I think that they're all connected and they all spin off in various directions, but come back to the same thing.
Yeah. Any final words?
Don't wait. Start now.
Ooh. Excellent.
Just a small step. Do it now. JFDI.
Perfect. Thank you so much.
Thank you.